I'm specifically referring to probes, are classified as reusable medical devices in as much as they touch the patient. And because of their reusable medical devices, they need to be disinfected. They cannot be sterilized because that would denature the crystals and the ceramics that form the probes. They have to be disinfected. And the level of disinfection that's required of the probes really depends on a risk assessment, the risk of acquiring organisms and transmitting organisms. Now, the tool that's used to assess risk is the Spalding classification. This is a very old system. It must be at least 40 years old. And it divides reusable medical devices, including probes, into three categories: non-critical, critical, semi-critical, and critical, depending on two things. One, the organisms that they may become contaminated with, but primarily it's based on their risk of transmission of infection. So non-critical devices are those that come in contact with healthy, intact skin that are not contaminated with body fluids. Semi-critical with wounds, for example, non-intact skin, mucous membranes. An example of this might be a toe probe or a toe study or a transvaginal study. And then critical studies or critical probes are considered those that come in contact with sterile tissue, which isn't particularly common in intensive care, but those devices that come in touch with blood vessels and with the bloodstream are deemed critical. And this, of course, refers to when we use needles, such as vascular device insertion, pleural taps, etc. And so we assign basically a level of risk, and based on that, we can then assign what degree of or what level of disinfection. So for non-critical studies, intermediate or low-level disinfection is appropriate, and for either semi-critical or critical, high-level disinfection is required for the probes. The disinfectants used, first of all, a disinfectant that is used on a medical device needs to be of an instrument grade, and these are regulated and regulated by the TGA, or Therapeutic Goods Administration. There's low-level, intermediate level, and high-level disinfection dependent on the range of organisms that they kill. So let's begin with low-level disinfectants. They kill most bacteria that we meet, the exception being mycobacteria. They do have some activity against some fungi and some viruses, and this would include COVID-19. Intermediate level, again, low level, it has the same activity against, but it certainly has extended spectrum against mycobacterium, most fungi, and most, but not all, viruses. High level, the big advantage is that it kills most spores. And this, of course, is important with Clostridium difficile.